Hello, my fellow classmates. My name is Abdur-Rashid, and my need assessment is on community assessment barriers to treatment. The purpose of my need assessment is to establish barriers, community strengths, findings, and recommendations. Strengths in the community are the Port St. Lucie County for Community Engagement Agencies, prescription drug discount cards, New Horizons of the Treasure Coast, which is a comprehensive substance abuse and mental health abuse facility, and we do offer medical transportation for those that need it. My findings was that there was a lack of utilization of peer-oriented services delivery to the accessible care in order to assess behavioral services. Funding, lack of funding, and continuum of care or discharge planning aftercare. Develop peer-oriented services. Developing work opportunities for people with lived experience in the mental health system, including family members. Hiring peers will help address the shortage of service providers. Integrating peer support in the range of crisis services. Contracting with a peer professional organization to provide technical assistance on recovery, vision, implementation, and program development, such as crisis respite and crisis residential programs. Building capacity for peer support and peer-oriented services models to implement data-driven policies and evidence-based programs in a variety of community settings and among diverse population groups, and connecting individuals with peer support prior to facility discharge and during aftercare to promote both self-advocacy and community integration. Funding recommendations. I used an example taken from the Florida Health Assessment. Funding resources such as the United Way. The issue was recession, economic recession, and not able to raise funds for the United Way. Some of the strategies were advocacy to political representatives and legislators, making community aware of the issues, and so those were just a few of how you can increase funding, but the biggest part is the advocacy piece. Recommendation of continued access to services, initiation of supplemental security income and other public benefit applications before discharge, and transportation to the Social Security office and other offices if needed, and provision of contact information for suicide hotlines and warm lines. Example, have a card that can be carried at all times, daily check-in with a peer provider if desired, provision for at least 3 months of a disability bus pass or other transportation assistance if needed, and provision of some financial assistance if needed, for example, grocery store gift cards. My data collection process was my interview with Andrea Gates Gonzalez, who is a licensed clinical social worker. She is Division Director of Inpatient Services at New Horizons of the Treasure Coast. Secondary data came from Disability Rights, which is in California, and St. Lucie County Community Health Improvement Plan. How I intend to share my findings is to email my interviewee on my presentation, She was my only point of contact, so I will be sharing my recommendations with her. Reflections. Experience was extremely challenging because of where I'm geographically located. I'm in Port St. Lucie, Florida. So that was an issue. Lack of response from community providers, either because they're understaffed or they're just not available. What I learned from this community needs assessment is that it's a complex process and is an ongoing effort. Thank you so much for watching. Bye-bye.